Welcome to the deep dive. Okay, so today we're looking into something called Indian neurotherapy. The sources you sent over describe it as a healing system, one that claims it can sort of reset your body.
Yeah, that's the core idea. It suggests we can do this often without drugs, without anything invasive.
Just by using the body's own intelligence. That sounds pretty bold.
It is a bold claim.
Yeah,
and it's
yeah.
compelling because, well, the whole philosophy rejects adding external chemicals. It's framed as a natural method designed to work with the body's own system.
Right. Okay, let's unpack that. For anyone hearing this for the first time, neurotherapy, how do we define it? Is it like reflexology? Because the sources seem to suggest something more systematic.
Yeah, it's more specific. We can define it as applying precise, quite calculated pressure.
Okay.
Applied to specific nerves, muscles, and yes, reflex points across the body. But the goal isn't just, relaxation. It's about systematic stimulation, really trying to correct how organs function. And the method, as the material lays out, was developed by Dr. Lajpatre Mehra.
Got it, Dr. Mehra. And our mission today then. Let's call out the 5 big, powerful benefits that supposedly make this therapy stand out. We need to get past the bullet points, understand the how behind these claims.
Exactly. Especially that focus on restoring internal balance, not just, papering over symptoms.
Yeah, symptom masking versus actually healing.
Precisely. And if we look at how healing is presented here, it often starts with the most common complaint people have.
Yeah.
Chronic pain. Immediate relief is a big hook.
Okay, let's start there. Because that's where the philosophy really seems to diverge from, the usual approach, right? Chronic pain often means management painkillers, maybe anti-inflammatories. But neurotherapy seems to lead with this idea of removing the root cause. What does that actually mean in practice?
Well, that brings us straight to our first major takeaway. Significant pain relief, but without medicines.
Okay, so we're talking about the typical things, like
Yeah.
persistent back pain, that awful neck stiffness.
Exactly. Sciatica, that sharp nerve pain, or just general chronic joint discomfort. The sources claim neurotherapy can really intervene effectively in these cases.
How? What's the mechanism? Because it sounds physical, obviously.
It is. It's a localized physical intervention. When they apply this calculated pressure, it's not just blocking a nerve signal like a painkiller might.
Right.
It's meant to actively activate blood flow and increase oxygen supply right to that tense or affected muscle area.
So the pressure is like jump-starting the body's own repair process in that spot.
That's a good way to put it. By forcing better circulation, it helps correct the muscular tension itself, which is often the actual physical root of the pain, especially with things like sciatica. There, the pressure points might relieve compression around that inflamed nerve.
So painkillers mask the signal. Neurotherapy tries to fix the environment so the signal just stops needing to fire.
Exactly. It aims to normalize the tissue environment. And patients apparently report relief pretty quickly, sometimes within a few sessions, and crucially, without the side effects or dependency risk of long-term medication.
That focus on safety and maybe a more lasting fix is key. But does the pain stay gone? Is it permanent or more like ongoing maintenance?
That's a really important distinction the sources touch on, because chronic pain often comes from, lifestyle factors, right? Poor posture, diet.
Sure.
So the initial treatment tackles the symptom, gets you relief. But the long-term aim is more about systemic balance. It helps the body heal. But ongoing attention might be needed if those underlying lifestyle things aren't adjusted.
Right. It empowers the body, but doesn't magically erase, years of bad habits.
Exactly. It's not an absolution.
Okay, that makes sense.